Good afternoon, everyone, and thank you for joining our April 2nd daily briefing. I'd like to begin with an update on the development of alternative care facilities in the state, which are essentially field medical stations designed to alleviate the crush of COVID-19 cases at area hospitals. Last Monday, I informed you that in Cook and the Collier counties, where the vast majority of COVID-19 cases are today, we had formally launched work on 3 facilities: McCormick Place in Chicago, the former Advocate Sherman Hospital in Elgin, and the Metro South Health Center in Blue Island. Of these, McCormick Place will be our largest facility, slated to reach a total of 3,000 beds. Kane County's Sherman Hospital and suburban Cook County's Metro South Center will together host more than 500 patients. Today, we formally added a 4th location to our capacity, Westlake Hospital in Cook County's Melrose Park, which will host 230 beds. Construction at all 4 of these sites will be completed on a rolling basis throughout the month of April. We're also finalizing the necessary steps to stand up an alternate care facility in Central Illinois in the coming weeks, and I look forward to providing you with the update on that very soon. As a reminder, these temporary facilities are meant to support, not replace, our existing medical infrastructure. Patients will be directed first to existing hospitals, and if they are lower acuity, they will be transferred to these alternative sites. We're also adding additional beds at our existing institutions every day. But for a rough picture, we had about 26,000 non-ICU beds and 2,600 ICU beds across the state as of March 24th. About half of our non-ICU beds and less than half of our ICU beds were available then, and those numbers have only dropped in the 9 days since. We're adding capacity at existing hospitals along with the capacity that we're adding at these alternate care facilities so that we can treat more patients. We talk a lot about increasing hospital capacity as a critical component of our approach to COVID-19, but I want to take a moment to remind people why that is. This is a novel coronavirus, which basically just means it's new to humans. There's no vaccine, and no one is immune. That's certainly not the only difference between this virus and other viruses, but it's a significant one. Because of the lack of immunity in our population, there's a greater risk of overwhelming our medical systems if too many people get sick from it all at once. It's that simple. And that is why we are building up the necessary hospital capacity and alternate care facilities as much as we can muster in the coming weeks. As I've said throughout this process, building out hospital capacity is only part of our approach to COVID-19. We also must slow the spread of the virus. If we don't, there could never be enough hospital capacity to treat all of those who would become ill. Our job, all of us in Illinois, our job is both to keep our health systems operating within capacity and to keep our residents, especially our older and immunocompromised residents, safe. Here's the thing. I've already taken virtually every action available to me to slow the spread. We were one of the first states in the nation to move to a stay-at-home order, among the first to close bars and restaurants and limit public gatherings, among the first to close schools. Now, a majority of states and many more municipalities, including several that made a point to avoid such action early on, have followed suit. And I take no pride in being earlier than others, but I'm honestly upset about the lack of early action on a national basis. This will go down in history as a profound failure of our national government. I'm telling you this because I want you to know that in terms of state action, state orders, We've nearly exhausted every avenue available. Now the rest is up to you. Our strongest weapon against COVID-19 is you. Already the vast majority of you understand how critically important your actions are in our greater social distancing efforts. Almost all of you are doing it right. I see all that you're doing to stop the spread. I see the people who are staying home. I see the emptier streets. I see the essential workers keeping people fed and safe and healthy and keeping their social distance. I see you fighting for each other, Illinois. I see you as tough as you are kind, as courageous as you are creative. I see you taking care of one another, and I'm very proud. For a little while longer, we must all commit to staying home, staying safe, and practicing social distancing to stay healthy. Every one of us must abide by this if we are to get through this difficult time. So to honor you and to bring us together in our commitment to doing what's right, I'm introducing a new statewide initiative that we can all participate in, and it's called All In Illinois. All In is our anthem and our point of pride. Illinoisans staying home for the good of each other and for our state. Today I'm asking all of us, all of you, to join in and be all in for Illinois. All in for our neighbors, all in for our grandparents, all in for cancer survivors and those who are immunocompromised, all in to protect essential workers like grocery and drugstore employees and food delivery workers. All in for our heroic doctors and nurses, respiratory therapists, social workers, EMTs, pharmacists, ER technicians, registration staffers, sanitation services, and the hospital food service workers who keep our patients fed. Join us and take the pledge. Pledge your commitment to go all in for Illinois. Go to allin.illinois.gov and take a look around. See comedic actress Jane Lynch telling you why she's staying home, and hear from Veep star Matt Walsh, athletic phenom Jackie Joyner-Kersee, actor and comedian Dion Cole, Chicago PD star Jason Begg, and there are many more to come. You can also print your own yard or window sign. You can update your Facebook profile picture with a themed frame. Display the words "All In for Illinois" proudly. Post your own videos on social media demonstrating your pride. Be all in. All in Illinois means we care about one another. It means we care about our communities. We are one Illinois, and we are all in this together. Thank you, and now I'd like to invite the Director of our Department of Public Health, Dr. Ngozi Ezike, to give her update for the day.
Thank you, Governor.
Thank you.
This morning, I called into WJPF's Morning News Watch with Tom Miller. His show broadcasts throughout Southern Illinois and informs communities each day about what is happening in their part of the state. As you can imagine, all the talk revolved around COVID-19, and my message to them was that even in the rural areas of the state, the virus is present, and they should join all their fellow Illinoisans in staying at home so that we can all get back to normal on the other side of this pandemic. Today, we have added an additional 715 new cases and 16 additional deaths. That brings our Illinois totals to 7,695 cases and 157 lives lost. As we have reported before, approximately 85% of the deaths in Illinois are among those 60 and older, but that doesn't mean that it's a death sentence. I recently spoke with our third and fourth cases of COVID-19, a couple in their 70s, and they're both doing great, and they were happy for us to share that information. But no age is immune to contracting the virus, and we have seen individuals younger than 1 and over 100 years contracting the virus. We're also starting to see clusters of cases in essential businesses. And although these businesses need to continue operating, they must take steps to protect both the employees and the customers. Employees should be monitored for symptoms, and their temperature should be checked daily. Anybody who's sick should absolutely be sent home and stay home. Businesses should be thoroughly cleaned each day, and measures should be in place to protect clients. That might mean keeping customers at least 6 feet away from the cashiers, or if plexiglass can be intervening. And I have to go here regarding churches and other religious services. There are reports that people are still holding services. I understand the importance of communing with fellow believers, but let's understand, kids are home from school, people are home from work, schools and offices are closed, religious houses have to do the same. We all must make this sacrifice. Then, on the other side of this pandemic, we can gather at the mosque or the synagogue, the church, the museum, the library, all of these places that we love. We must not continue putting people at risk. Please hold virtual services, whether by web or phone. I may sound like a broken record, but these are all things we have to do. It just can't be some of the community that's following these restrictions and these guidelines. We all have to do it together. Let's be all in for Illinois and do our part to end this pandemic. And now I'll summarize the comments in Spanish. Esta mañana llamé a la estación de radio local en el sur de Illinois y hablé con Tom Miller. Su programa se transmite por todo el sur del estado y informa comunidades cada día sobre lo que está pasando en su parte del estado. Últimamente, todas las conversaciones son sobre COVID-19 y mi mensaje para ellos fue que en las zonas rurales del estado el virus existe. Deben unirse a sus compañeros de Illinois para quedarse en casa, para que pronto todos podemos volver a la normalidad. Aunque el número de casos ayer a hoy son más bajos, estamos reportando 715 casos nuevos, incluyendo 16 muertes. Tenemos 7,695 casos y 157 muertes en Illinois. Como los informamos, aproximadamente el 85% de las muertes en Illinois se encuentra entre las personas de 60 años o más. Ningún grupo de edad es inmune a este virus. Hemos visto casos en individuos menores de 1 año y mayores de 100 años, y en todas las edades intermedias. También estamos comenzando a ver más grupos de casos en negocios esenciales. Aunque estas empresas necesitan continuar operando, deben tomar medidas para proteger a los empleados y a cualquier cliente. Los empleados deben ser monitoreados para detectar síntomas y sus temperaturas deben revisar diariamente. Cualquier empleado enfermo debe quedarse en casa. Las empresas deben limpiarse todos los días y deben tomarse medidas para proteger a los clientes. Poniendo plexiglas entre los cajeros y los clientes, manteniendo una distancia de 6 pies entre las personas. Iglesias, escucha que todavía hay algunos dando servicios. No debemos seguir poniendo a las personas en riesgo. Mantenga el servicio virtual, sea por internet o por teléfono. Eso es solamente para ahora. Puede sonar como un disco rayado, pero estas son cosas que todos tenemos que hacer. No puede ser solo parte de la comunidad. Cada persona debe ser. Si hacemos nuestra parte por poner fin a esta pandemia, vamos a salir adelante. Ahora es el tiempo a trabajar juntos, porque solos no podemos. Sí se puede. And with that, I will turn the podium back to Governor Pritzker.
Happy to take any questions. Mary Ann.
I have several brothers who have asked me to ask their questions. First of all, there, folks are concerned about the people in prison.
Yes.
Should more be released? There have been some civil rights folks who are having a press conference about that today.
So I'll repeat the question for those who couldn't hear your question. Is a question about should we be doing more to release prisoners during this time? I want to remind you that we had more than 1,000 fewer prisoners in prison today than we had on February 1. We've been in process of reviewing cases, especially during this crisis, but quite all along. And especially looking at vulnerable populations and trying to let them go. For example, we commuted sentences of pregnant women and women with babies that were in prison. We looked at cases of nonviolent offenders who were, for example, retail shoplifters who are serving relatively shorter sentences but would still be in prison now had we not reviewed their case and let them out and given them, commuted their sentences, essentially. We looked at other nonviolent cases like narcotics convictions and we've been processing those as well. And then finally, just recall that one of the important rules that sits in place today is that when you let somebody out, when you commute their sentence or early release them, they have to have a place to go. You can't just release them on the street and have them become homeless immediately. And we also want to do a medical check and so on. But the most important thing is they have to have a place to go. And there are a number of people who may have met a certain criteria who did not have another place to go. So we've been doing, I think, a lot in this regard, and we continue to. I want you to know my legal staff every day. We have lawyers on my staff as well as the Department of Corrections director and his staff looking at these cases precisely because we want to do, I think, what activists want and certainly what we want, which is to lessen the pressure within prisons where they're in such close quarters that they might be communicable to one another. But I also want to say that we are treating these prisoners who do get, they're in a congregate setting. I want to remind you, it's different than a nursing home, but similar in a way, right, where people really can't move out very easily. And so we want to make sure they get the medical care that they need, as well as quarantine them properly from the other prisoners in this case. So we're doing a lot in this regard, and I know that there's still more that we're working on.
What about unemployment? Many people are saying they are on hold when they call. They cannot get through, as well as online. It says, please come back. Is there any way to speed up that process?
So the question was about IDES, our Department of Employment Security, and unemployment claims that are coming in every day. And this is the biggest onslaught of unemployment claims, I think, ever, at least in my lifetime, and even more so than the Great Recession of 2008, 2009. I want to remind you that the systems at IDES were actually rebuilt in 2010. Now, you might think, well, gee, then shouldn't they be running properly? Well, it's now 10 years later. Not a lot of investment was made in the state's IT systems in that last 10 years. And they were operating properly for the number of claims that were expected, over that 10-year period. The system was operating. Now it's 10 times as many, or whatever the multiple is now. And so the systems aren't acting properly. And I've been talking to our Department of Innovation Technology, which is partly responsible, talking with IDES staff, which is partly responsible. And then we've also asked the public, to those who are filing, to segment themselves by the first letter of their last name, to call on certain days and certain hours and so on. We're trying to spread it out as best we can. But the truth is that the system does go down. It went down this morning for a short period of time. They were working very hard to get it back up. Didn't quite come back up in the same hour that they thought it would, but an hour later. But believe me that we're trying very hard to both answer every call, which is hard to do because, we have a system that just there aren't enough people. We've asked many of our staff to stay home, as many businesses are, but we also have non-essential staff there to help augment whoever is there. So again, this is a problem. I don't know exactly that we're going to fix it entirely so that everybody could do it all at once, but we have asked people please to spread out their calls and spread out their their applications online and to use the online system, because that really is the best way to do it, and do it in off hours.
Governor, reaction to the Chicago police employee that passed away. Also, is there confirmation that this is the first responder to die from COVID-19?
So I believe this is the first police officer that has passed away in the state of Illinois. And I just, to all of our first responders, to all of our police officers who are out there every day, they get up every morning and they leave their homes knowing that they're going to interact with the public. They don't know who has it. Many people have it and are walking around with it and don't know they have it because they're not showing any symptoms. And police officers nevertheless have to interact with the public wherever they may be. And so the bravery that's demonstrated every day by these officers and the tremendous loss that to all of us in the state of Illinois when someone who's willing to put their lives on the line every day loses their life is something I think that we should all take pause about and just remember how important these folks are.
Governor, the state of Michigan and Indiana have both canceled in-person school for the rest of the school year. They're going to move exclusively to e-learning. How long before Illinois does that? And then, if I may, after a question to Dr. Ezike regarding the number of recoveries, that was a question asked a few days ago. I understand it is a tough metric to track, but do you have any update on that? I think there are a lot of folks out there looking for some sort of silver lining in the numbers regarding how many people have beaten this virus versus school.
I don't have a good answer for you. Will school be canceled for the rest of the year is really a decision that will get made, as we get closer, as we get, hopefully, as we enter a peak period, whenever that may be, sometime we think in the later half of April. And then we start to come off that peak. I think we'll start to be able to make some decisions about what does May look like. So with that being said, I'm going to turn it over to Dr. Ezike.
So again, I know that we need hope, and I want people to be hopeful, and I want to say that the majority of people recover well. I know I gave the initial data after the survey was put out earlier this week that said that 7 days after diagnosis, essentially 50% of the people reported that they were recovered. And so that's something that we can do weekly to update, and I'm sure that those numbers will only increase. Like, that was just 7 days after the positive test and 50% recovered. So if we were to do 14 days after the diagnosis, you can imagine that those numbers will only grow. So we'll continue to do those surveys. We'll do that weekly, and we'll continue to report, because we do need to people to have that hope and know that it's not a death sentence. And again, remember, we had a couple in their 70s that contracted the virus. They were our third and fourth case. We talked extensively about them. I just talked to the wife this morning, and she was saying, yeah, we're doing great, and we're old. Yeah, you can share that. And so that was really why I wanted to put that out there, because it is not a death sentence, but we definitely mourn the loss of every single life, and we're keeping all of their family and friends in prayer.
The 50%, I'm sorry, the 50%, just to follow, the 50%, that's Illinois.
That's Illinois. That was just the cases that we had 7 days post a positive test. Yeah.
Dr. Ezike, you talked about the cluster, you said that there's some businesses. Could you give us more info on that?
So obviously, we've seen cases in all settings, right? We've seen it in the schools, we've seen it in daycares, we've seen it in prisons, we've seen it in nursing homes, and at places of work, we've seen it. And so we know that there are some workplaces that have to continue, but then even though they have to continue, we don't want that to be a site for continued transmission. And so we're trying to impress upon these work sites that we have to make sure that we promote social distancing, that we have to make sure that people who are coming to work are in fact healthy. We don't want any sick workers at work that could now be the vector transmitting the virus. So all of these measures need to be taken so that because we have these essential workers that have to continue their job, we want them to, whether it's provide food, whether it's fill the shelves at our grocery stores, we need to make sure that that doesn't now become a nidus for infection.
Update on the infants and also state.
Okay, so the process to do that kind of investigation the question was an update on the infant, and also an update on Stateville. The investigation is still ongoing. I was talking to our partners at the CDC last night. We don't have a completed investigation. When that is available, I will share. Regarding Stateville, I'm happy to report that the people who were infected were moved into a separate part of the facility so they could be separated. We had 19 people that were hospitalized yesterday. I'm happy to report that it's 16. Again, here's another glimmer of hope. 3 people recovered and were released from the hospital. So definitely people can even recover. We know that most people recover, and here's another example of people, and these are elderly people and people with multiple other medical conditions that do complicate the course, but 3 of those individuals have been released from the hospital. Thank you.
Governor, could you talk about yesterday, Senator Durbin said that you had been reaching out to airlines about a flight to China to bring back PPE. Where does that stand?
Well, let me repeat the question for everybody. There was a question about comments that Senator Durbin made on national television about the fact that I'd been on the phone with airlines trying to get our PPE from China, which is where much of it is made, to the United States. It is true that I have been making calls night and day to make sure that we can not only locate and procure PPE wherever it may be in the world or in the United States, but also to make sure that it gets shipped here properly and promptly, by the way. And as you can imagine, there is quite a lot that has been held up over some time because of the challenges of coronavirus in China. And so the shipping from China has been, curtailed to some degree. It has begun to pick up again, but as you can imagine, there's a backlog of everything that was going to be shipped from China, not just PPE. And so trying to get to the head of the line, because we have an urgent need, is critically important for our state. And so that's why I'm calling heads of airlines, heads of shipping companies. I'm calling private individuals that I know have connections in China, because the Chinese government has been a little bit difficult at putting PPE at the head of the line to be shipped to the United States. And I've asked the federal government, the United States government, which is, you may have heard the last day or two, the president talking about the air bridge, he's been calling it, from China, where they're shipping goods back to the United States. Well, the reality is that the air bridge is carrying private goods for private companies. It can be PPE, but they're private goods. They're not going to the states. They're going to private companies that are then distributing it to their customers, whoever they may be. And that there may be states that are on those customer lists, but they may also not be. And so I asked directly, well, could I put goods that are bound for Illinois, that we are acquiring, PPE for the people of Illinois, on the air bridge? And essentially the answer has been no. And so I'm doing everything I can. And I will say that we've had a little bit of success. We're still working on it. We're talking to people at the highest levels of major shipping companies and talking directly to them. I'm on the phone with them. And I also was on the phone with advisors at the White House to try to get them at least to help me to get those companies to do what we need for the people of Illinois.
I have a downstate question. What are you doing to ensure the state's medical supplies are getting to medical providers at downstate hospitals, nursing homes, and other service providers, and not just ending up in a warehouse?
Great question. So the question was, how are we making sure that our supplies of PPE are being distributed around downstate Illinois and not just going and staying in a warehouse somewhere? And the answer is, we're shipping out everything we're getting. We know exactly where we need to ship these goods to. We understand where hospitals stand. We're talking to them every day. We have a survey that they fill out every day and let us know what their stores of PPE are, how many days they may have left of PPE, and so on. So we're, as soon as we get whatever we get, we are shipping it out to various places. Downstate Illinois, southern Illinois, central Illinois, northwestern Illinois, Rockford and surrounding counties are all getting PPE shipments. We're shipping it to public health departments in those counties, as well as directly to hospitals and health centers and to nursing homes.
Mary Ann, do you have any other ones?
I do have one more.
Okay.
She's taking your job.
I know.
Wisconsin is going ahead with their election, knowing what we know about the virus. What recommendation would you give to the governor of Wisconsin, as well as maybe perhaps Dr. Ezike? And is there any evidence that holding the Illinois primary election spread the virus further?
So I would say to Wisconsin, I don't know what the laws are about mail ballots in Wisconsin, mail-in ballots and absentee balloting, but it was very important in the state of Illinois. Many, many people took advantage of mail-in ballots. Many, many people early voted, and that really helped us in terms of diminishing the number of people who we knew might show up at a polling place. And given that it's an all-day vote on Election Day, and people had the ability all day the day before and all day the day before that and 45 days before the election to do it, it was something that was doable for us. But I must say that I guess the only advice that I would offer is make sure you're coordinating with your election officials, that they know how many volunteers they have that are actually going to show up, and perhaps don't listen to them when they say they're all good, they don't need any help, and use the volunteers that you have available to you as governor or as legislature to augment, the need. But mail-in ballots are the best way to run an election right now. And so I would encourage everybody in every state that has an upcoming election and every state that doesn't have mail-in ballots, they should pass that immediately and let people vote by mail.
Okay, last question in the room.
Earlier in the week, when we talked about McCormick Place, you said 500 beds will be available this week. Is that still the case? And also, gun stores, still essential businesses. Can you talk about that decision?
So the question was about the 500 beds. Are they really going to be ready at McCormick Place this week? And about why gun stores are considered as essential businesses still open. As far as the 500 beds, I got a sneak peek at the work that's being done there. Let me just preview just briefly that you should all feel very, very proud, honestly, of the work that's been done so quickly by patriotic Americans. These are carpenters who are showing up, and they're building out this amazing facility in 5 days. 5 days. And you could see that on their faces how proud they are to be doing it. They know they're doing something that's going to save people's lives. Carpenters, National Guardsmen, Army Corps of Engineers, the people who work for MPEA, that's the McCormick Place. Those are, they're amazing people, and I think you'll get a chance at some point to see what it looks like and to report on it. But I just want you to know it is going to be completed, and it's amazing to me. I didn't know you could make something that big, build something out like that in 5 days, and they'll be completed tomorrow. Yeah. Sorry about gun stores. Look, we wanted to make sure that people had the ability to protect themselves if they needed to. I think that there are a number of things that I think one person might not consider essential and somebody else would consider essential, but it was just something that we felt, would be important. I think there were quite a lot of people downstate who felt like, they'd like the opportunity at least to be able to buy ammunition or something else because they might want to go hunting by themselves or to protect themselves. So.
Okay, we got to take a couple from our reporters online. Have you been given solid promises on, one, Illinois having first dibs on the Abbott Labs rapid test and expected date for when they will start to be used in Illinois?
What was the very first couple of words of that?
Have you been given a solid promise?
Got it. So Abbott Labs, let me just compliment them. I spoke with them literally the day they made the announcement about their rapid tests, and they were so incredibly responsive and helpful. And we expect to have machines online very shortly. They are shipping those. We may have already even.
Supposed to be getting it today, 15 today.
We're getting 15 of those machines today, according to Dr. Ezike. And I knew we were getting them shortly, and the ability to do these rapid tests, which take 5 to 15 minutes each, as opposed to what is now basically a 4 to 6 hour test, is really a game changer. Obviously, the more of those tests we can do, the better. They're creating these, they're manufacturing these for the entire nation, but they have said that Illinois is going to be, because we're their home, that we're a priority for them, and so obviously they're delivering on that promise with the first 15 machines already.
Do those machines go in the hospitals or the labs?
Various places. We want to just make sure they're most effectively used, and remember that very important to us is collecting the data, right? Because we're not going to be able to, there's no way, we've all told you, to test everybody out there, and so we want to make sure that wherever they go, the data is available to us so we know how many people are contracting coronavirus in what locations.
What other measures are you considering to help renters? Other places in the U.S. are implementing rent caps and prohibiting landlords from charging late fees. Will Illinois implement measures like these?
I guess I'd say two things about that. Sorry, the question, well, I guess you've said it, so I don't need to repeat it. Two things. One is that we have a state law in Illinois that imposes a moratorium on rent control, and that state law can only be repealed by the state legislature. So that is not something that we can do by executive order. But what I have done is ordered sheriffs in all 102 counties that they may not evict anyone during this period of time, during this crisis. So we're doing an awful lot of other things to make it easier for people during this crisis to stay in their homes by, making sure that there are no shutoffs of utilities, and providing other services in neighborhoods so that people are at least able to stay in their communities and in their homes.
This will be our last question. Is this new All in Illinois campaign related in any way to concern that as the weather gets nicer, people are going to want to go outside in bigger numbers and ignore social distancing?
Well, I wish we had thought of it a month ago, maybe. But if the answer is, do I think that people should listen to All in Illinois and follow it, and not go outside, or at least not congregate in groups of 10 or more outside? Yes, I want people to follow the rules. And so, having said that, this is a fun way, I think, for everybody to feel camaraderie with one another, to feel as if, we are, in fact, all in this together in Illinois. And I am so very proud of the people of Illinois for doing what they do across the state, for following the rules, and this is one way for everybody to show their pride.
Thank you.
Thank you.
Thank you very much.
Thank you.
Thanks for watching, and if you haven't already, please consider subscribing to our channel. And while you're at it, please leave us a comment. Thank you for watching.